and welcome to another episode of Health with Dr. Yvette Masika. This is a podcast that aims to correct myths around health. And today we're going to talk about pregnancy, what you need to know about pregnancy. And I'm joined by my colleague and my dear friend, Dr. Namunji Matale. Welcome again.
Thank you. It's good to be back.
So, what do people need to know about pregnancy?
Okay. So before we can even talk about pregnancy itself, people need to know how to prepare to get pregnant or how to prepare to plan for a pregnancy. Most people only visit the doctor when they've already discovered that they're pregnant.
Yeah.
And a lot of the time it's not necessarily planned. So
Yeah.
when people hear family planning, they think contraception, how to prevent pregnancy. But family planning is literally one budgeting for it to, planning to fall pregnant. And there's health aspects to that and deliberate steps someone should make in preparation for them to fall pregnant. For example, when you're pregnant, at the hospital, they'll give you folic acid and iron and the like. You're supposed to actually take your multivitamins before you get pregnant. So if you plan on falling pregnant at some point in the year, at least 3 months before, you should consider taking your multivitamins, and most importantly, under supervision of a trained doctor. So it's actually important for people to go to the hospital in the first place and say, "Hi, doctor, I want to fall pregnant. What should I do?"
Yeah, but most of our pregnancies are just accidents.
Yeah. Oh, oops babies. They're cute, but they're oops babies.
Yeah, and also especially for people with underlying conditions. For example,
Exactly.
if you have conditions like sickle cell disease, you have heart conditions, you have diabetes, you have hypertension, it's very important that you plan your pregnancies.
Exactly.
Yeah, it really reduces the risk of maternal deaths and also of you actually losing the pregnancy. Yeah, that's why it's important.
Exactly.
So pregnancy is divided into first trimester, second trimester, and third trimester. In the medical field, we don't really use months.
No, we don't.
So I always have to calculate.
We use weeks.
Yeah, we use weeks.
Yeah.
So the first trimester is 0 to 12 weeks.
Exactly.
And then second trimester is 13 weeks to about 27.
28-ish. 27, 28-ish.
Then the third trimester is from around 28 to 40 weeks.
Exactly.
So in the first trimester, what do people expect from their pregnancy?
Okay, so first of all, how can one know they're pregnant? Pregnancy is special. I think it's one of the most beautiful and confusing states in the entire world, if you ask me.
But it's also risky.
Yes. Yes, it is. So with pregnancy, of course, if your menses are regular, you will miss them. The first thing you notice is, oh, I missed my period. And that's how most people even take a home test. They go pee on that fancy little device. Or as I like to say, pee on a stick.
Literally.
They'll go pee on a stick, and then it will show them those 2 lines, and then they're like, "Oh, I'm pregnant," and then that's confirmed at the hospital with the same urine test and the like, and a scan, of course, which will show that okay, there's actually a viable pregnancy in this lady's womb. And then for some people, just as a side note, pregnancy, with the way hormones I'll use the word misbehave, with the way hormones misbehave, you find that some people might feel like, how patients will say, "Nimbela, malaria." A lot of the time when someone comes to me and they say, "Nimbela, malaria," and you're like, "Did you miss your P's?" Yeah. I'm like, "Okay, go pee on a stick." So pregnancy can present in so many different forms. Someone can even have a nasty flu. And if you ask them, "Did you miss your period?" Actually, and then they go pee on a stick and they're pregnant. So look out for just changes in your body corresponding with you missing your period. Yeah. And then what to expect? Some women experience morning sickness. Unfortunately, for others, it extends to the end of the pregnancy.
Yeah.
But ideally, it should stop at the end of the first trimester. So, your body is going through all these hormonal changes to accommodate this little being. So, it gets uncomfortable. Some experience hot flashes, others the same morning sickness. Some of them experience bouts of weakness and random hunger. It just comes with its own fair share of different experiences.
You just don't feel yourself.
Exactly. You are cooking a whole other human being.
That's true. That's really true. So, and some of the things that you see on your body in the
Mhm.
first trimester or when you're pregnant is that, um, so when you look at your genitals, you're going to notice that your vulva, like people confuse the vulva and the vagina,
Yeah.
but the vulva is what you see,
Yeah.
and that little hole
Is the
inside
vagina.
is the vagina.
Yeah.
So what you're going to notice is that what you see is, you notice that there'll be hyperpigmentation. So basically, it will start looking darker, and it will start looking edematous.
Yeah.
So it will start looking swollen.
Exactly.
And you also notice that, well, you may not notice that the vagina is also becoming edematous, but
because it's on the inside.
but yeah, the vagina also becomes like swollen inside. Maybe that's why some men actually enjoy sex more
Wow.
when when someone is pregnant.
Wow, Dr.
No,
Yvette.
that's true. That's true. There are a lot of men on the internet who've come to say that they enjoy sex when their wives are pregnant.
Maybe it's some kind of
And
strange fetish.
some
I don't know.
people actually go out to look for pregnant women too.
Oh my. Okay.
Yeah.
Okay.
Yeah.
Wow. I wouldn't want to comment to that.
So the other thing
Too much on that.
So the other thing you notice is that your vagina will be producing more discharge.
Yeah.
Then
more secretions.
Yeah, you have more secretions.
Like everything goes into overdrive because
Yeah.
of this little human being.
And then your skin will also become dark.
Mm-hmm.
You just look different.
And have you noticed the pregnancy nose?
Oh,
We need to do research into that. Like, why does the nose get bigger? Not for everyone, but for
Yeah,
a
for
number
some.
of women that we see, the nose gets bigger.
And they say it's worse when you're having a boy.
What does testosterone do?
Makes your nose big. Looks like you have a little fist on your on your face. So the other thing that happens in pregnancy is that you notice that, of course, your tummy gets bigger.
Yeah,
So
you
the
have
uterus,
a whole growing
the
human
uterus
being.
will move from like 4 mils, which is almost like a teaspoon,
Yeah,
to 4 liters.
yeah. Echigubu of
Yeah.
sorts. I'm just picturing echigubu when you said 4 liters. But yes,
That's really a lot. And then the hormones also cause you to have constipation because they reduce your bowel movement.
And on
Ish.
top of that, as you talked about the uterus expanding from as tiny as it is, like 4 mils to 4 liters, you have the uterus moving the organs around.
Yep.
So you find that the heart is displaced a little bit, the pressure of the growing baby is pushing up on your lungs. That's why some women complain, in certain positions I get breathless, and it's exhausting.
Yeah.
And as the baby gets bigger, it does a little dance on your bladder. That's why pregnant women are frequently going to urinate,
Yeah.
Yeah.
And then weight gain. So in pregnancy, you can gain up to 12 kgs.
Exactly.
12 kg.
You just thought about that.
Yeah.
Which is why it's important to know your weight pre-baby.
Yeah.
Know how your body functions pre-baby so that you have kind of like a baseline to work with.
Yes, because we get worried when you're losing weight.
Yeah.
So in pregnancy, it's normal to gain weight.
Exactly.
So you can even gain up to 25% of your pre-pregnancy weight.
Exactly.
So before pregnancy, if you were 100 kg, you can expect that you can go up to 125 kg.
Yeah. But that should be towards the end of your pregnancy. Yeah.
Towards the end. So this 12 kg that they talk about, they say that you gain 2 kg in the first trimester, of course, because the baby's still tiny.
It's still tiny.
Yeah, then in the second trimester, you gain about 5 kg. And then the remaining weeks, you gain 0.5 kg every week.
Yeah.
That's how many kgs in a month? That's like 2 kgs every month.
2 kgs every month till you make that 12 kg benchmark.
Yeah.
Carrying a human being is work.
It is work.
It's work.
And then after you deliver, then not all the weight
comes back immediately.
Yeah.
There are those ladies who bounce back like, oh my God, like you weren't pregnant in the first place. And then there are others who it's a bit harder for them to go back to pre-baby weight. But just don't put yourselves under pressure. You carry the whole human being.
Yeah, that's That's a lot.
It is.
So, in the second trimester, what are some of the symptoms that someone can experience?
Okay, so for people who are experiencing their first pregnancy, sometimes what they feel as gas might actually be the baby kicking.
Oh.
So with the first pregnancy, you find that someone who experienced that actual kicking, they'll be able to say, I felt the kick around 18 weeks, somewhere there. But for someone who's like a seasoned, pregnant woman, like this is not her first baby, they actually feel as early as even 16 weeks. Say, okay, the baby's kicking. But yeah, for most first time moms, they think it's gas, but what you feel as gas is probably your child moving.
Yeah.
So you will, in the second trimester, you will experience the same perception of your baby moving. And then also, second trimester, in terms of what we look out for as medics, is anemia. Because there's certain changes that happen with the lady when she's pregnant, like there's kind of like dilution of the blood, so to speak,
Yeah.
for lack of a better term, which causes what, like unexpected anemia. It's a medical anemia, which is why we always give pregnant women folic acid and iron.
Yeah.
But it's kind of worsened in your second trimester. So we pay particular attention to your blood levels when you're in your second trimester. But one thing I should note is in the first trimester, we check all your baselines so that we know where you're starting from in terms of your blood levels. That's your hemoglobin or your HB and your and the like. We want to know what someone's liver and kidney function are. I mean, we'll throw these terms around so that you won't be confused the next time you go for antenatal and your doctor says some of these things. Of course, we do screening. There's so many things we need to screen for in pregnancy, from STIs, so that's HIV, syphilis, even hepatitis B.
Yes.
And then also we need to look out for, like I said, your baseline functioning of your organs and the like. And then we also want to do, in the first trimester, what we call a dating scan, which is considered accurate in terms of how far along you are in your pregnancy. Because sometimes with your last menstrual period, it's not always accurate because maybe you forgot or you can't remember the exact dates, or you didn't have regular menses, so it's just confusing in the first place that you're pregnant.
Yeah. So ideally, you should have your first antenatal visit in the first trimester. So whenever you find out you're pregnant, please don't sit at home waiting. You have to make contact with your nearest healthcare facility where they offer antenatal services.
Exactly.
Because as she mentioned earlier, you're supposed to start taking your supplements like folic acid, which is very important in the development of the nervous system, which is your brain and your spinal cord.
Exactly.
Yeah, it's very important in that development. So you're supposed to be taking it 3 months before that. Now imagine you're already late and you're pregnant and you're like, okay, I'll start going when I'm maybe 4 months. That's not right.
Exactly.
Whenever you find out you're pregnant, you go to a healthcare facility. So when you come to a healthcare facility, of course we do the baselines as she said, then we do the dating scan, because some of you do not know when your periods are.
Yeah.
So even if you have abnormal periods, you don't even know because you don't keep track. So in the previous episode we did for cervical cancer, you were advising people to even get an app or a diary.
App.
Yeah.
I am so pro keeping a period diary, whether it's on your phone, in a book somewhere. It's so important.
It is, because
and not for us as practitioners, for the patient, for you.
It helps us to help you.
Exactly.
Or to serve you better.
Exactly.
Because if you don't know when your last period was, it's quite hard.
It is quite hard.
Especially if you come with abnormal bleeding. You won't even know. If there's what we call implantation bleeds when you're pregnant. So if you don't know you're normal, you don't know how much you bleed, you may think that's a normal period.
Exactly. When you are probably even miscarrying for all you
Yeah.
know. And on top of that, there's things we look out for, like sizing of the pregnancy. There's what we call, for example, small for gestational age, where the pregnancy appears a bit too small for how far along you are.
Yeah.
And sometimes there's what we call large for gestational age, where it's bigger than it's expected to be for that time. So all these things fall around the dates and how long we expect you to have been pregnant for.
Yeah, because in those cases we have to compare your last menstrual period and what the scan is saying.
Exactly.
Are they, yeah,
do they make sense? And which
because
one
they're
do we
supposed
go
to
with?
be a 2 week difference.
Yes,
yeah?
about.
Yeah,
Plus
two
or
weeks.
minus
So
2.
if the scan says you're 14 and your period says you're like 12 weeks, that's acceptable.
That's acceptable.
Yeah, but where your scan says you're 16 weeks and then your period says that you're 12 weeks.
Yeah, it starts to get tricky.
Yeah.
So okay, which one do we go for? But most
Mm-hmm.
times we'd go for the scan.
Yeah,
Yeah.
the dating scan, which is done around 8
To 12.
to 12 weeks, yes, in the first trimester. So that's about 3 weeks. I mean, sorry, 3 months into your pregnancy. So please do not come after 3 months. Just come when you know that you're pregnant. Ish, I can't even overemphasize this.
I know. And on top of that, now that you've mentioned scans, some people have myths concerning scans. Some people think they're dangerous. And you'd actually hear people sitting and discussing, no, don't go for too many scans. They're dangerous. Ultrasound scans are perfectly safe for pregnant women.
Yeah,
it's the scan of choice, actually.
Yes, because it's an ultrasound.
Exactly.
It uses sound. It doesn't use radiation. Okay.
Exactly.
So please don't, there's no limit to how many scans you can have. Sometimes we can actually request for you to have a scan every week so that we monitor your baby's growth, especially if it's a high risk pregnancy.
Exactly.
Where we're targeting to reach a certain weight for us to give you an early delivery so that we can take your baby to the NICU and all that. So scans, we don't consider scans dangerous. It's different where you're using like X-rays.
Exactly.
Yeah, those are now harmful.
And
to
of
the
course,
baby.
if a pregnant woman needs an X-ray for one reason or another, we do a shielded one. Like,
Yes.
you wear protective PPE, so to speak. Yeah, you
They
wear
make you wear a
protective
shield,
equipment.
yes,
Yeah,
so that your baby is protected.
exactly.
So when you come for antenatal, apart from checking your blood level, we also advise you on what foods to take, what physical activities you can do. We also tell you how to prevent STIs. All those things are done every antenatal visit, at least the first antenatal visit. We also advise you on how you can deal with morning sickness, how pregnant women get a lot of backaches.
Yes, they do.
Yeah, so we check if maybe you have a urinary tract infection, because pregnant ladies
they're so prone to
UTIs.
Like, they're so common. I find them annoying. No, not that I've been pregnant before, but I find them annoying because I see the discomfort in our patients when they're having a UTI. Some UTIs are so bad that you can think you've gone into labor.
Yes.
Yeah. Like, the pain can be so immense that you think it's mimicking labor.
Yeah, that's I feel bad for them.
Yeah.
Like, you can barely touch
Yeah.
their abdomen, and
Yeah.
they'll be in so much pain, and you're like, oh, could this be? Even you as a healthcare worker, you start suspecting
like,
labor.
okay, are you in labor?
Like,
then you have to examine them to rule it out.
Yeah.
As you've mentioned pain, Dr. Yvette, not just pain, but if you are pregnant and you are experiencing symptoms that you feel are out of the normal, please go to the hospital.
Yeah.
There's no harm in asking people, but let your final say come from the hospital, because you never know if you're at risk of losing the baby. Anything could be happening to you, especially if you bleed. Bleeding is not normal in pregnancy. There's a lot of people who say, no, I continued having my period when I was pregnant.
Yeah.
You should not be having a period when you're pregnant. In short, you should not be bleeding at all when you're pregnant. So please, if you're pregnant and you notice yourself bleeding, don't post on Facebook, say, hi guys, my name is so-and-so, or dear auntie so-and-so, I'm 8 months
From
pregnant and I'm
anonymous.
bleeding, what should I do? Go to the hospital immediately. Bleeding during pregnancy is not normal. Yeah.
No, it's not.
I just had to put it out there.
only the implantation bleeding, but
At the
still, but only
beginning.
we should tell you that
Oh,
this
this
is
is implantation. Don't
bleeding.
decide for yourself.
Yeah, to say, oh, this is probably implantation bleeding,
Yeah.
which is wrong. And one other thing that I forgot to mention that we do, especially on the first antenatal visit, is that we take a history.
Yeah.
So we ask you about your previous pregnancies, how the outcome was,
Yeah.
if the baby is still alive, did you have any problems during your pregnancy? Did you have any twin pregnancies? Does your family have any twin pregnancies? Do you have allergies?
Yeah.
Any family conditions like diabetes, hypertension,
Exactly.
heart conditions? All those things are very important, and we're also supposed to know your HIV status.
Exactly.
And it's mandatory. Every pregnant woman we test for HIV.
Literally in every trimester.
In every, yes, because you may be, we've actually seen this.
Yeah, where first trimester
Yeah,
someone
you're
comes
negative.
negative, they don't even have syphilis.
Yeah,
Third trimester, everything's changed.
they're
Yeah.
positive.
Yeah.
And that's how some of the babies end up being born positive or
Exposed to syphilis.
exposed. Yes, also because the mom doesn't know that she's positive, so
Yeah.
she continues breastfeeding the child normally, and she's not on ARVs.
Exactly.
Because if you're on ARVs, at least there is suppression of the
and you
of
protect
the
your
virus.
baby.
You can breastfeed, but
Yeah.
if you don't know, your viral load probably is through the roof. You're putting your baby at risk.
Exactly.
So it's mandatory to test for HIV.
And
At
don't
least-
get offended when we screen
Yeah.
you for STIs. At this point, it's not just about you alone. We have two patients we're dealing with, you and your baby.
And also,
So it's to protect both of you.
yeah, and men, if you're listening to this or
Please,
watching this,
we beg.
please come for antenatal.
Mhm.
We love seeing you coming for antenatal.
Holding hands. He's carried
Yeah.
the Kama bag and the booklet.
It's so cute.
It's adorable. I love it. Personally, I always, give them a high five to say, please keep up with this.
Yeah, it's very important that you're involved from the beginning so that you understand what your partner is going through.
Exactly.
And if your partner is found with an STI,
we'll have to screen both of you and potentially
you.
treat both of you.
Because if we treat the pregnant woman for an STI and you're not treated,
you give her back.
You're giving it back. And it may even go to the child. So you both need to be treated for STIs.
And
in that
on
case,
top of that, if we can stick to one partner, please do it. It's not, like I said, it's not just about your pregnant partner anymore, but it's also about this child.
Yeah.
I'm an advocate for people to just stick to one sexual partner, because it's very unfortunate for someone to show up with, say, syphilis positive results when they're about to deliver, meaning this baby has been exposed to this syphilis, and syphilis has horrible effects on little ones. It affects their brains. Some of them end up with seizures. They can end up with blindness. They can end up with even meningitis. These things are very serious. People like to joke about them, but they are very detrimental to not only your partner but your unborn baby. So if, for the purposes of anything, think of your unborn baby when you go about doing your business. Stick to one partner, please.
If you can't, at least use protection. At least.
At the very least.
Yeah. Use protection, please.
Think about that baby.
One thing that I've noticed when we were growing up, I think in our era, we had a lot of HIV talks.
Yeah.
It was all over the TV.
We had poems in school.
Yeah.
Do you remember the HIV poems? Yeah, we had poems in school.
You killed my mother. You
killed my
father.
dad. Yes.
Yeah, we had
all
that.
Them.
We were receiving those books that had the ribbons on them. We had those rulers.
There was the anti-AIDS club.
Exactly.
Does anti-AIDS club still exist? I don't know.
I don't think so.
I don't have younger siblings in school, so I wouldn't know.
I don't think so. So I just wish that those things continued, because HIV is still a nuisance.
Yes.
I mean, it's
improved.
The
incidents, but it's coming back.
Yeah, it's coming back.
It's coming back harder, if you ask me.
Yeah, seeing a lot of young people.
And with the coming of PrEP, I fear that people will abuse it.
Yeah.
Don't abuse PrEP. Side note. We digress, Dr.
Yeah.
Yvette.
Oh, sorry. Yes. So, we've talked about what we do in the first trimester when you come for antenatal. Now we move to the second trimester, which is from 13 weeks to like 27 weeks. So, what do we do for our patients?
Okay, so typically second trimester, we'll want to start this patient on malaria prophylaxis, or if you want malaria prevention. I mean, we live in a tropical country where malaria is rampant. So to prevent our women from getting malaria, we put them on Fansida, as
Yeah.
we know it. Simple,
And
simple drug, but it's a powerful, powerful drug that protects our women from about 16 weeks. So you expect her to
yeah.
get a single dose every month that she comes for antenatal, about 3 to 4 doses depending on how it goes.
Yeah, and we know that many people don't tolerate Fansida well.
Yeah.
Most of them complain of nausea and they just feel sick after taking the Fansida, but it's important.
It's so important.
Malaria, I mean, we've made it sound like a
Hey.
simple condition. The way we talk about it, nivella malaria and things like that, but it's very serious. You can have a miscarriage. You can
You
have
can
a
die
stillborn. You yourself can die.
because malaria comes with so many complications. Some people have fits. Some people develop severe anemia. Actually, a number of the patients who are pregnant who receive with very low blood levels, first thing we think about is
It's
malaria.
malaria. Yes.
So it comes with its own drama. Some people go into a coma. It's not a nice condition to
So
have.
yeah, please take your Fansida. If you're HIV positive, we give you Septrin.
Yeah.
So please take your Septrin. We don't give HIV positive patients
Fansida.
Fansida, no. So you take your Septrin. Yeah. What else do we do in the second
So we do an
trimester?
anomaly scan, what we call the anomaly scan at about 20 weeks.
Yeah.
So remember the dating scan from the first trimester, which gave us the dating of your pregnancy or how far along you are. So the anomaly scan is meant to pick out if there are any abnormalities in your baby.
Yeah.
So it's a detailed scan. You know, they look at every organ of your baby. How is the skull and the brain developing? How are the organs developing? Is this baby appropriately sized and appropriately weighing the appropriate gestational age? All of that. So that's what we do at the anomaly scan.
So this is a scan that tells you the sex of your baby. At this point, that's when we can tell the sex of your baby.
But for legal issues, some of us prefer not to say the sex of the baby.
Yeah, because some people have bought all pink baby things
and then
ended
the
up
little boy
being
shows up.
Yeah. And then some bought blue things and a little girl showed up.
Exactly.
So you find they come for antenatal with the child and you're like, oh,
It's a boy.
it's a boy. No, it's a girl. But
Yeah.
we bought all pink things, so yeah.
Yeah.
So
So just embrace
they're
whatever
not-
baby you have.
yeah. Yeah. What else do we do? So we give Fansida.
We do the dating
We do
scan.
the anomaly scan. Can
Sorry,
tell
the
us-
anomaly scan.
Yeah. So basically, I think in the second trimester, all your baby is doing is just growing. Yeah.
And of course, we'll repeat your full blood count to see,
Yes, to
how
see if-
well your blood levels are doing.
Yes, we'll monitor your blood pressures, monitor your sugars, all those things we do.
Oh yeah, and one thing we forgot to mention, urinalysis.
Oh,
We
yes.
like to check the urine during antenatal. It's a simple test, but it's actually life-saving because it gives us an idea if you're developing what we call preeclampsia. It's a type of condition that affects women and causes them to have high blood pressure and high protein in their urine. It can be life-threatening not just to baby but to you as the mom as well.
Yeah.
So it's something that we do on routine, checking the urine. Simple test, but so life-saving.
Yes, especially if your blood pressures have been high or if you're hypertensive, expect us to be checking your urine. So ideally, antenatal visits, you should have at least 8.
Yeah. The
8
entire
in
pregnancy.
your 8 in your pregnancy. So you have the initial you have at least one visit for the first 7 months, like every month.
Yeah,
You have
having
one
one.
visit up
Yeah.
to 7 months, and then we want to have every 2 weeks.
Yeah, bi-weekly.
But this is not cast in stone. No two pregnancies are the same.
Thank you.
Some of you from the start will need to see you more often.
Depending on
yeah,
the condition.
we may
'Cause
say
some people's pregnancies are more
like
problematic
yeah,
than others.
high risk. We can even tell you that we'll be seeing you every single week.
Yeah.
So
And please don't shy away. I know the hospital can be a bit of a scary place for most people. They want to be at home. But every time we propose these things to you, it's not a punishment. It's
No.
so that we can have you go home with a baby in your arms. The
Yes.
worst nightmare doctors have is when a lady carries a baby up to term or up to 9 months and goes home without the baby. That's
Yeah.
one of our biggest nightmares. Or worse still, no one going home. So please, let's work together so that we can serve you better. When we offer you certain advice, it's not because we're trying to impose ourselves on you or we're trying to be bullies, but it's just for the betterment of you and your baby.
Yeah, and there are some patients we actually need to keep up to the time they deliver.
Yeah.
They come to
3 months, someone
yeah.
is in hospital. Yeah.
3, even 5 months.
Yeah.
You come to us at 4 months and we notice it's a high risk pregnancy. We're like, nah,
You're not going anywhere.
Long hospital stay.
Yeah.
And sometimes you feel sad for them, but they need to stay in hospital, especially those who can bleed at any time.
Exactly.
You need to have blood readily available on the ward, so that
those with extreme heart conditions,
so that if you bleed on the ward, immediately we start transfusing you, which can happen at home.
No.
So we need to keep you
Mpaka you get the yango, you call your mother.
Mpaka you start waking up your partner to say this is what's happening.
This is what's happening.
First,
no, we haven't packed the bag. It sounds funny, but it's very real.
And also make sure that you have that bag.
Yes,
they're always emphasizing when you go for antenatal that you should have this emergency bag that has your baby clothes, your baby blankets. You need some gloves, some cotton, an umbilical cord clamp, just
your delivery pack, in short. Get ready.
if you have a car, just pack it in the
keep it
so that whenever anything happens, you're ready to go.
Yeah.
It's very, very sad to see a baby delivered and wrapped in a blanket.
Borrowed.
Without
borrowed.
Yeah.
Don't forget borrowed.
In a borrowed blanket.
Yeah.
Without any socks on, without any what are those things called?
The head sock.
It's a head sock.
Casote.
Yes, without a casote, without anything. And this is the reality. I mean, sometimes the wards do have, but they run out.
Yeah, depending on the facility. Yeah.
So guys, just even if it's Sally's clothes,
wash them
it's
nicely.
It's
iron
like
them
1 quarter
nicely.
for babies.
Yeah.
They're very cheap
Yeah.
on Sally's. It doesn't even matter. Just wash them, dry them, iron, and pack.
Have something on hand.
Yes,
and always
please.
have a 50-60 kwacha for an emergency cab, please. It's not always that you're at home with someone. Say you start bleeding heavily, you need to come to the hospital, and there's no one. At least have enough for cab fare. If you don't have a car, that is, at least have enough for cab fare. Or if it's 2 buses away or 3 buses away, have enough for you to get to the hospital. Always. Whether it's in your Airtel money or it's in cash or whatever it is, whatever mobile money you use, always have emergency money on standby for you to go to the hospital.
It can be life-saving.
It can.
Ish. Like, I think people don't even understand what happens in the background when we lose a mother. There is so much that happens.
You can't bring her back.
Yeah.
It's the worst thing. I think it's one of the worst things ever.
Yeah, no one, as obstetricians say, no one should die giving life.
Yeah.
So please keep that money on hand. Visit your antenatal care facility on a regular basis.
Exactly.
And please don't wait to Don't wait to go for antenatal at 8 months or 7 months.
Especially if you've had babies before. I mean,
Yeah.
moms who've had several babies tend to be like, no, this is not the first
Yeah,
one.
like the one.
I'll go to my ends. No, 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 no. Every pregnancy is unique.
Mm-hmm.
All your first 4, 5, 6 babies could have come out okay.
Yeah.
Then the 7th one will shock you.
I'm telling you.
So please, 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 treat every pregnancy as a unique one.
Because that's what we do.
Yeah.
We
There's
always
nothing like, oh no,
no,
second
yeah,
born
yeah.
probably would be like the first. No,
Mm-mm.
every pregnancy is unique.
Yeah, that's true. And one thing we forgot to mention is that when they come in the first trimester, we always want to know their blood group.
Yeah. So important.
Yes.
So important.
It's very important, not only because you may need a blood transfusion, but there are times when the baby and mom don't have compatible blood groups.
Yeah.
That actually happens, and we won't go into it.
But let's just say it can cause risk to the baby
Yeah.
or future pregnancies.
Mm-hmm.
Yeah.
And but we do give medication to help. Unfortunately, it's a bit expensive.
Yeah. To be honest, health is expensive.
Health is expensive.
So people should invest in their health. Have emergency money for health things, guys.
Yeah.
Yeah.
So in the third trimester, in the last
third trimester, final stretch. Oh wow. When I see ladies in their third trimester, they just look exhausted. You will be tired.
Yeah.
You get a lot of patients who say, mucho se no, and you're like, guys, sit put, You're almost there. Let's do this. You're almost at the finish line.
Yeah.
So you will be the most exhausted.
Mm-hmm. Swollen feet.
Swollen
maybe.
feet.
Mm-hmm.
You'll be definitely at your largest in terms of weight.
Mm-hmm. You'll be constipated
a lot of the time. So constipation, because of what's going on in the body, and on top of that, the iron that you're taking is adding to all of that.
Yeah.
You're peeing
and also,
every 5 seconds.
because they take iron, your stool will look dark.
Yeah.
So some get alarmed when they are taking the iron tablets. So your stool will look dark.
Yeah.
And
Peeing every 5 minutes.
Yeah.
Well, not every 5 minutes, but you know what I mean. You'll frequently be peeing because this child is putting pressure on your bladder.
Yeah, you may actually be peeing when you're not peeing. For example, when you cough, you may just feel a little or you're trying to pick something up from the ground and you're like, whoop.
What was that? Pregnancy is a beautiful thing. It's a beautiful, beautiful thing.
It is, but there's some exercises that help you with
Yeah.
that.
Kegel.
Yeah, Kegel exercises, very good, especially after you deliver. Yeah. But I think it's easier said
than
than
done. Yeah. So, of course, we'll do a final trimester scan, and depending on how high risk your pregnancy is, we could request for frequent scans. Or, like you mentioned earlier, if someone has bleeding in pregnancy, we'd want to look at the scan to see what could be the source of the bleeding and the like. Really, third trimester, we're just preparing you for birth. If your blood is low, we're going to transfuse you with blood to make sure, you have enough blood, because we know that during childbirth women bleed. So we want to make sure you are top tier to deliver this baby and bring life into this world.
Yeah. So the scan that we do is also to show the presentation of the baby. So is your baby coming with the head or is it coming with the buttocks? So if the baby is coming with the buttocks and it's the first time you're delivering, that is a straight Caesar.
Yeah.
There's no two ways about it. If you've delivered before and the baby is coming with the bums,
they may or
we
may not
try, especially if the baby is like a reasonable size. But if the baby is big, no.
And most times, most times these days, with a baby being born breech, a lot of obstetricians prefer not to even allow the mom to deliver naturally.
Yeah.
Because your baby's head is at risk of being stuck. There's so many babies who are born or so many women having stillbirths because, the head was stuck, baby suffocates, and, it's a horrible outcome. It's not a nice thing. So to avoid that risk, oftentimes I've noticed that obstetricians will offer you a cesarean delivery. So please, just a brief on cesarean delivery. It's a life-saving procedure. It's not an insult to your womanhood. It doesn't make you less of a mother. There are these myths where people say, no, you don't bond with the baby. no, you will bond just fine with your baby even if you have the operation. So please, if ever you are offered a cesarean, or maybe you have a relative who's been offered a cesarean, remember that it's a life-saving procedure. It's not demeaning. It's meant to just preserve both the baby and the mom.
Yeah.
Yeah.
There's so many myths
There's
around.
so many.
Yeah.
And
But
people wanting to get in, no, what do my in-laws think?
yeah.
All these
And
things. It's
please,
meant to protect you and baby.
please don't make the woman feel inferior because she had a cesarean section.
Exactly.
Most of the women are actually worried because apparently in society, you're not woman enough if you have not pushed a baby through your vagina.
I mean,
But no.
you even hear some people say, oh no, she's too posh to push. It's not like that.
Yeah.
Like you said, people don't realize the magnitude of pregnancy and child delivery. It's literally 50-50, life and death. That's why there's a whole specialty of medicine dedicated just to that alone.
Yeah. And
so
this is why I say, if you're not willing to die for that man, don't get pregnant for him.
I agree. Because you can die.
Yeah.
You can die. You actually can die. Childbirth is 50-50. So yes, cesareans,
They say mapusukeni
for a reason.
Yeah.
Which means you survived, isn't it? Yeah.
because they know that it's like going to war when you're going for labor. And that's why you see people so restless, especially if your wife or your girlfriend is in labor. Everyone is restless, the moms, because everyone knows that so many things can go
happen.
wrong.
Yeah.
And these people only start saying, oh, she was too posh to push after you're alive and well.
And you have a healthy baby.
Yeah. But if, okay, God
by
forbid,
some chance,
if for some reason the person died, they'll be the same people saying, oh, she should have just gone for the Caesar and things like that.
People love to talk.
Yes, and they'll never stop talking. If you don't take the Caesar and your baby dies,
it's her fault.
They'll say, oh, why did she refuse the Caesar? If you take the Caesar, your baby's alive. Oh, she's a weak woman. Why didn't she push? So people will always talk.
Always.
Put yourself first. Put yourself and that baby first. Okay.
Exactly.
Please.
Cesarean is life saving, and you are still a woman. You were a woman before, and you will be a woman after, and you will bond with your child. There's nothing like, oh no, you won't bond with your baby. You will bond perfectly.
Yeah. And I mean, a Caesar, it's a surgical wound, so surgical wounds generally heal quite fast. After 2 weeks, you even forget that you had a Caesar. But also, people heal differently.
Yes, please.
Some people have complications from the Caesar, but everything medically has complications.
Yeah.
Even paracetamol itself, Panadol, has side effects.
You're saying Panadol, this same fancy that people drink for malaria. Some people are allergic to it, so you have to give them other options. So with everything that you do to your body, whether it's a drug you take or an operation, there are complications. But that's why, practitioners are there to help, ease whatever it is that you're going through.
Yeah. So I think we've talked about everything. Okay, not everything, but the important
stuff.
Yeah, so in the
delivery. Yeah. What we've been aiming for. Please, those manners that, oh no, I've gone into labor, I'll go tomorrow morning. Go to the hospital when you just notice that I think this is labor.
Yeah.
You're better off going to the hospital. You're better off sitting in a ward waiting to deliver than sitting at home and arriving when things are almost happening. I mean, there's so many people who end up delivering at home, which is not safe,
Yes. And because you're rushing, you're going to forget important things. You're going to forget your antenatal card. You may even forget the baby's clothes.
You wrap the baby in a chitenge that you borrowed from someone.
Okay. Yeah.
So yeah, it's so important that when you feel that, okay, I think I'm going into labor, go to the hospital. Even if you are a seasoned, child bearer, for the lack of a better term, go to the hospital. There's nothing like, I've been here enough times. No. Go to the hospital.
So that we can assess, do you need to have a Caesar done?
Exactly.
Are you going to do a normal delivery? I've just remembered there's a patient who I received, and the baby was in breach.
Okay.
And she came right at the verge of
That happens
delivery.
a lot.
She had no scan.
Oh no.
She wasn't going for antenatal.
So in short, you have nothing
We
to
had
work
nothing
with.
to work with.
You became a sangoma in that moment.
And we couldn't do an ultrasound just
Because
there
the
on the
baby's
ward.
right there.
Yeah. She was coming with the baby's bums hanging out.
Oh my.
Yeah. But anyway, the baby survived.
Thank God. Thank God. But that doesn't mean you should try that. For some people, the stories come out horrible. It's just that we don't want to start mentioning too many. But for some people, they don't always get the positive outcomes. So please, soon as you notice that you've gone into labor, go to the hospital. And also, if you've noticed that it's not yet time, like you haven't reached your, 37 plus weeks or even 40 weeks or then, and you notice that, it's a bit too early for you to be going into labor, go to the hospital. Don't assume things.
Yeah.
Don't ask Dr. Google. Don't ask Dr. Facebook, Dr. Mbuya, Dr. Neighbor. Who else is Dr. Mother-in-law, Dr. I'm not saying people can't have insight, but let the final say come from the hospital.
It's better safe than sorry.
Exactly. And then also, if you notice that you are past 9 months, please come to the hospital. We call it post dates.
Yeah.
Where you should have gone into labor but for one or another reason you haven't. We'll need to deliver your baby as soon as possible because everything that's meant to have happened has happened, and your placenta is now just going to get tired and won't be able to support this pregnancy. So please make sure if you're past the 9 months, come to the hospital. In fact, don't even wait to get past the 9 months.
Yeah.
But this is for anyone who's watching and is past 9 months. Go to the hospital.
Yeah, because the initial scan, the dating scan, will actually give you an EDD. So at least you have an idea of when you should deliver your baby. So if it's 2 weeks past that, the baby needs to come out.
Oh, can we tackle funny myths?
Please.
My favorite ones. Don't drink tea when you're pregnant because you'll burn the baby.
Or you see a baby with a large birthmark and
they drank tea. So the baby sits in the uterus, the womb, okay? Your stomach, very different. Your baby does not actually sit in your stomach. Your stomach is for food. You know? There's even acid in there. Your baby wouldn't survive in acid. So feel free to drink your tea. Yeah. But avoid coffee and things with caffeine when you're pregnant. Speaking of which, so many things people shouldn't take when they're pregnant. Which is why you need to go to the hospital. Even when you have a flu, there's certain medication you are not supposed to take because you're pregnant. Even small things like lozenges, you cannot take when you are pregnant. So please, when you're pregnant and you feel unwell, go to the hospital. Even for the simplest flu.
Especially painkillers. So pregnant women have a habit of taking painkillers. Please avoid painkillers. If you can, just go to the hospital so that we can prescribe proper painkillers, because some painkillers actually are a risk to the baby. For example, after a certain amount of time, we're not supposed to give you things like Brufen, diclofenac, all those things, those funny combinations as well. I won't mention them. I don't want to get sued. But so just come to the hospital so that we can prescribe proper painkillers. You may actually need some antibiotics sometimes. So
because it's a UTI.
Yeah, it could be a UTI. It could be another infection. And pregnant women are also prone to having this acid reflux because of all the pressure that you're having. So you'll be having this burning sensation somewhere there on the chest. So it's just because your pregnancy is pressing on the stomach. So that acid in the stomach is going into your esophagus, which is between the mouth and the stomach. It's a tube.
Or your food pipe, if you like.
Yeah, the food pipe. So acid is not supposed to be there, hence the burning sensation. So we like putting our pregnant mothers on some antacids. I'm not going to mention because some of you will start self-medicating.
I'm telling you, go to the hospital.
So go to the hospital if you're having that heartburn. Yeah. So any last words for our our viewers and
Yes,
listeners?
please. I'll try not to take too much time. But yeah, please, when you're planning for a pregnancy, go to the doctor, go to the clinic, go to your hospital. Find out what it is you need to do, what you should start taking, so that they do your baseline tests as well. Know where you are generally in your state of health. And then whatever the medical practitioner prescribes for you, please take it. Don't avoid your folic acid and iron because you're like, no, I don't like the smell and whatnot. I know it can be annoying, but remember, your baby can be born with spine issues, brain issues. Some babies don't even survive after birth
Yeah.
because of some of these things, because someone didn't take folic acid. So it's so important. Take your vitamins, take your folic acid, take your iron, go for antenatal in the first place. Don't avoid your scans, have your emergency money for that trip to the hospital, which could be unexpected. Don't ask Dr. Google, go to the hospital for real. I wish we could talk more about pregnancy for what it actually is, because we don't realize it's very 50-50. It's literally life and death for both mom and baby. So we need to treat it cautiously. I mean, it's a beautiful thing while, someone's about to bring in life, but it also comes with its risks. So we need to do the most to take care of our pregnant women and their unborn babies as much as possible. So yes, if you experience strange symptoms like out of the ordinary, go to the hospital. I prefer someone who frequents the hospital than someone who sits at home and then things happen. Yeah, that would be my take home message.
And my take home message is when you find out you're pregnant, please don't take alcohol.
Thank you.
No tobacco. No
Thank you.
smoking. If you live with someone who smokes, please tell them to smoke from far away.
As in outside.
Yeah, outside where there's open air so that you don't inhale that smoke. Eat healthy, eat a lot of vegetables, take a lot of water.
Yeah.
Take a lot of healthy foods like brown bread, unpolished rice.
Yeah.
If you can take this unrefined milli meal like roller meal.
Roller meal.
Yeah.
Or the one from the Chigayo.
Yes.
High fiber stuff, dark green vegetables, your fish, your eggs, those things are important. High protein.
Please.
Yeah.
That's the take-home message for me. This was Health with Dr. Yvette Masika with my guest, Dr. Namunji Matale. Thank you for coming.
Thanks for having me.
Bye.